Is that okay? Okay, good. Thank you. Before I begin, I would like to thank everybody for coming tonight as we talk about new ideas and issues. I'd also like to thank the fellow candidates for coming out to debate the issues and for wanting to represent our communities. My name is Stuart Taylor. I grew up in Alberta. I've been a registered professional forester for 40 years. I retired 5 weeks ago and was a senior manager for the government of Alberta, working on aspects of oil and gas, coal, and forestry in the local area. I believe Alberta is at a turning point during this election. We've had the same government for 40 years, and we're witnessing the effects of having a government go unchallenged for so long. Recently, the PC government has resorted to muzzling its local representatives, wasting billions in misguided priorities, and has posted 5 straight budget deficits. While Rose plans on doing things differently, we want to change a culture of entitlement, we want to doing things right, putting Albertans first. If I'm given the honor of being elected as your MLA, you can know that the interests of my constituents will come first, as all Wild Rose MLAs, and we give them free votes in the legislature. We will finally bring accountability and transparency to government. We run a government that focuses on Albertans and not self-interest. By allowing free votes and the right to recall your representatives will answer to you and not to your chief party rep. We will begin to get our fiscal house in order and prioritize our spending on what matters most to Albertans, on health care, seniors, and education. In doing so, we will balance the budget and build our savings. On health care, PC government continues to mismanage health care. They've squandered millions of dollars on executive health salaries. They've centralized health control in a massive health superboard bureaucracy that is unresponsive to local needs. They have subjected our healthcare professionals to intimidation and censorship and have misdirected billions of dollars on projects that are unable to open due to unavailable operating funds and staff shortages. Alberta's healthcare system can be fixed, but we cannot continue to allow the PC government to repeat the same flawed strategies and expect different results. Reforming healthcare will take honest and principled leadership. Currently, Alberta spends more on healthcare than any other province. It seems the more money we pour into it, the worse the problem becomes. That is because we're pouring money into a broken system. We have to fix the system if we're going to get better results. Wild Rose and their alternative budget plans to hire 1,000 new nurses. Wild Rose has a wait time guarantee to help Albertans and ensure that seniors get timely access to the 10 critical healthcare procedures prescribed within the time frame supplied by medical professionals. We're committed to public health care and upholding the 5 principles of the Canada Health Act. We will decentralize and return power to local decision makers and get rid of the ineffective health board. The end of bullying and intimidation of healthcare workers, which has happened under the PC government, we're going to end that and establish whistleblower protection for those that speak out. Seniors care. As individuals age, healthcare becomes a primary concern. The PC government has utterly failed our seniors in this regard. Despite continued promises, there remains a lack of funding for assisted home care, massive waiting list for rooms in long-term care and palliative care facilities, and sadly, seniors are often left to age in expensive and uncomfortable hospital rooms, away from loved ones, or in facilities with poor staff accounts. Wild Rose government will seek to amend this. Will introduce a kinship care program where family members who would otherwise be employed or compensated to provide extended care to their loved ones. Substantially increase resources to home care to allow seniors to age in the comfort of their own home. Grant the PC government's new seniors drug plan, which would introduce new premiums worth tens of thousands of dollars for seniors with fixed incomes. We'd implement a seniors prescription drug hardship benefit that assists low-income seniors. We'd allow seniors to defer property taxes against equity in their homes and work with municipalities to either freeze or restrict property taxes for seniors. We would implement the Alberta Energy Dividend that during surplus years will give back 20% of the surplus back to Albertans and into the funds of seniors. And we would hire thousands of senior care support workers. That said, I look forward to interacting with my fellow candidates and with others in the audience.